Hi Keith, we've brought you here today just to tell us a little bit about your journey and why you actually came to us. Could you just answer the reasons why you came to us?
I was recommended by Councillor Hensley because we both shared the same dentist who both retired within a matter of months, and neither of us felt confident with the chap who took over. He's got similar work to me, he's had bridge work done, and it was about a year ago, so it took me a while to actually come here, but that was because I knew I'd got a major problem, and a bit of a coward, you put it off a bit.
Of course. And what was your problems that you was actually having?
I had a bridge, and I knew there was a problem from about 4 years ago because the one side of the bridge, one teeth that was holding it, felt like hollow, and they were tapping it. They couldn't see any movement, but I knew it had come away or something.
And how did that affect you every day with eating and everyday life really? Did that have an impact on what you ate at dinner time?
No, but I was always aware, and gradually what happened is that the root of the tooth was breaking up and the whole thing was moving over, so I finished up with a gap of about 1/4 of an inch. And I was very aware of it. You know, you see yourself in a picture and stuff, and then you find you deliberately turn in a certain way and stuff because
you're conscious of it,
exactly
basically.
that.
And it became that you were conscious of it every day. So then what did you decide to do? You just decided to come for advice at the practice, or was it that you looked and found that we did implants here? Or
It was, again, John Hensley, because I see him quite regularly. We're on a couple of clubs together, and he just said that he found this guy, actually just lives up the road, didn't he? But so I came along. I was impressed with the equipment that was here. My wife had some treatment done. She's somewhere, and we had to go uptown to get a 3D X-ray or whatever it was called. And I know I just had it done here. So I think you like to be somewhere where you know they've got the best equipment.
Yeah. So your journey started then when you came through, and obviously things were explained to you by the dentist, Yasin Arani. And at any time, did you feel that you wasn't told anything that you sort of didn't know about, or was it that you just literally came in and felt completely happy with the whole service and that you were happy to proceed and go ahead with the treatment?
Yeah, I tell you what I get, which is hard to measure, is the confidence. Whatever we've said we're going to do has happened. A couple of times when a denture or something like that has been fitted, I've said it doesn't feel quite right. I've been back in a matter of days, and it's good. And that's the bit. I feel very confident that we've done exactly what we said we were going to do, and I'm well pleased with the result.
Oh, that's brilliant. And in terms of the actual treatment, did you find it uncomfortable at any stage, or was it just you were quite surprised that it went quite smoothly?
I never had a problem. I try and sort of pride myself that I'm a decent patient.
You are. You are.
I've never had to take any painkillers or anything else. The only thing that I was always worried about was lining up, as we put in 2 separate teeth. I had visions that I thought, when we put in the implant bit in, how do you make it straight?
So overall,
it's amazing.
So in a nutshell, overall your experience, just if you say
terrific, yeah.
And what would you advise to anybody that is looking to go down this road and have this kind of treatment? What would you say to them if they're inquiring about it?
It's relatively expensive, but it's worth every penny because it just makes such a difference.
And how do you feel now eating every day, and are you aware of what's in your mouth at the moment? Or
no, it's quite funny because a couple of days ago I was brushing the teeth and I was reaching for the denture and it suddenly dawned on me that
you don't have it anymore. Oh, that's brilliant.
Thank you, Keith.